If most healthcare leaders believe in the power of AI, then why is adoption of the technology so low in healthcare? That's a question we're going to dive into on this episode. According to a recent survey by Experian Health, over 60% of healthcare leaders see AI as a solution to their healthcare challenges. Yet AI adoption remains below 15%. Is it risk aversion, lack of proof, or simply an unclear strategy? Well, joining me today on the program to talk about how AI can be effectively used in revenue cycle management is Jason Considine, president of Experian Health, as well as Sharlene Seidman, senior vice president of revenue cycle at Yale New Haven Health. Let's get to it. Charlene, Jason, welcome to the program.
Thank you for having us.
Thank you.
I'm excited to sit down with you. This is quite the venue, too, to sit down for an interview. I appreciate you guys setting this up for us. Before we dive in, Charlene, maybe if you could just quickly introduce yourself to our audience, your name, title, and organization.
Sure. Sharlene Seidman. I am the Senior Vice President for Revenue Cycle for Yale New Haven Health System.
And Jason, you?
Jason Considine, President, Experian Health.
Well, it's lovely to have you both here. I'm excited to dive into the topic that no one else is talking about, and that is, of course, AI in healthcare. I joke, but I've been loving the conversations I've been having with people because there's so much nuance to this topic around AI. And you guys have been doing some pretty incredible things around AI. Is that correct? Am I correct in assuming that?
We have been. We've been at Yale New Haven Health. We've been on a journey for 5, 6, 7 years talking about AI and all of the phrases that go underneath that, and just trying to figure out how it can fit into our organization and bring value to what we do.
And Jason, you know, your position so unique, president of Experian. You've got quite a view of the industry. What are some of the challenges that you're seeing healthcare organizations face today?
Yeah, I think right now I would say payer-provider friction is at an all-time high. So all these rules that define how somebody's going to get paid are constantly changing. Regulations continue to change, and cybersecurity threats continue to impact an organization. And so all those things combine to make it a really kind of challenging climate right now for healthcare providers.
And Charlene, do you agree with those? Are those the same challenges that you're facing and seeing?
Yep, those are on our list of challenges. And to that, I would also add cost reduction. And we've been on a financial climb to fix some of the problems that we're having that are headwinds facing us financially. And so reducing our cost wherever we can is another priority for us.
Well, Jason, you mentioned that there technology. I mean, technology is often seen as the solution to, maybe the cause of sometimes, but mostly the solution to some of these challenges that these organizations are facing. You mentioned AI there. Do you see AI as being a big part of the solution for solving some of these and addressing some of these challenges head on?
I do. I think AI, the promise of AI is it's huge. Right, and so we've already seen applications of it where today we're using it to predict denials before they occur by learning from changes in payers' behavior. There's technology available today that is repairing information in the registration process, preventing denials from occurring to begin with. And I think as we continue to get more and more into what this technology is capable of, especially with like agentic AI, we're going to see more of those kind of high frequency tasks in an organization, those being able to be automated with AI.
So it sounds like a lot of the focus of where you're putting on AI is around those tasks that really don't and shouldn't involve a high-paid, high-priced human being who has a lot of knowledge. It's a lot of the repetitive tasks, as you're saying.
Yeah, I agree, and I completely agree with Charlene. I think one of the things health systems and providers in general have struggled with for forever is that there's a lot of work to be done and not enough staff to hire to do that work. And so a lot of these tasks may go undone at times in organizations. So if we can automate those high frequency, simpler tasks. It'll free up time and resources to work on the more complicated ones, and that'll have a big impact for provider organizations.
And Sharlene, have you implemented some of these technologies that Jason's mentioning?
We have. We have. And I would say from an RCM perspective, we can't do what we do without technology partners and service provider partners. And so we have to solve the AI or using AI together. We have to solve our problems together. And so we all need to think about this. And so what we don't want to happen is have our technology partners thinking one way and working down a path of solving something one way, and our outsourcing partners a different way, and we doing something entirely different. So I think that combining our strategies and solutions together is really important, which is what we've been doing.
And what sort of impact has this technology been having on your organization so far?
Well, there are a couple of things. We've been able to reduce cost, as I mentioned earlier, but we're also able to be a little bit smarter. So understanding our business and understanding where our challenges are and where we need to focus is where AI has been helping us.
Do you have an example you could share with us?
We have a couple examples, both on the patient perspective from patient collections and what I mentioned earlier with the cost shares rising, identifying who are those patients that are more likely to pay their bills and targeting that group a little bit differently than maybe a patient who is uninsured, and we need to identify, are they insurable? Can we help them understand, educate them on the benefits of being insured, and then doing some of that work. So that's how we've been using the information.
Yeah, it sounds like you're really using AI to personalize that interaction they have with you on the RCM side, which is something that is now only possible at scale with these kinds of technologies.
And essential.
Jason, so I got to ask this. You mentioned that AI and technology in general really is necessary to address some of the challenges that we're facing in the RCM space. And yet, adoption of AI in RCM and adoption of AI in general in healthcare remains fairly low. So how do we fix that gap?
Yeah, first, completely agree. We just recently did a survey. Most organizations are aware of AI and its potential application, but less than 15% have actually adopted AI in some way. And that doesn't surprise me. I think I've been doing healthcare my entire life, healthcare technology my entire life, and this industry typically lags other industries. Like, for example, I think we're single-handedly keeping the fax machine alive in healthcare, especially around like prior authorizations. But I think that speaks to the opportunity for provider organizations and the healthcare industry as a whole. Because the promise of this technology to drive efficiency, drive better patient outcomes is really, really substantial.
So Sharlene, what about you? When you look at your peers, even maybe in your own organization, and see that there's this gap, this trust gap, if you will, between acknowledging that AI could be helpful and actually not adopting AI, how do you justify that? How would you see maybe rectifying that?
I agree with Jason in that in healthcare, we are relatively risk averse, and we want to analyze the best solution that's out there and choose something that's been proven. And sometimes that causes us to move a little slowly. But there is promise, and in the last couple of years, there have been a lot of new entrants in this space, and our technology partners are understanding the need that we have and coming up with much better solutions. So I'm excited about what's out there to find the right partners to help us advance with this, and I think that we're going to be making some significant gains in the next couple of years that we haven't seen in the past.
Yeah, I have to agree with you because healthcare is risk averse, but then again, it is life and death, right? So I think generally people want us to be slow and careful because of what we do, and then as you're saying, the more proof points we start to get, the more evidence we have, I think then healthcare will quickly adopt this stuff. And I don't think yet we've had enough proof points.
Yeah. So we work in healthcare space. On the RCM side, we are protecting patients' financial health, which is very important. We're not going to harm someone physically. which is unlikely. But the impact that a patient has on when they're feeling comfortable and understanding their financial situation will help them to get better and to not worry as much, because I don't want our patients worrying about their financial situation. We want them to think about their care and recovery.
That's a great clarification. Thanks for pointing that out. And you're right. I mean, the financial patient experience is now acknowledged as being as important as the general patient experience, because it does and can cause a lot of stress when there's a lot of unknowns related to it. So the fact that you're using technology to fix that is pretty helpful. Yeah. Jason, you're working across many customers implementing this technology. How have you seen these proof points expand over the last little bit? And do you see it accelerating?
I do see it accelerating. We've seen organizations deploy this to reduce denials, already seeing evidence of automating the appeal process back to payers. And then in the registration process too, that's a complicated part of the revenue cycle. And if the data is not collected correctly up front, or even the incorrect data is given to the provider, it can cause all kinds of downstream impacts to the organization, and getting paid both from the patient and from the payer, and create not the best patient experience if that information's wrong. And so technology is being deployed to help understand where information is incorrect, repair that, and streamline that whole process. And there's many other places that we're seeing organizations deploy AI today.
Sharlene, you were nodding your head in violent agreement there.
I was. Did you? Yes. Yeah. Because I agree with Jason, the importance of insurance information and getting it right up front. The other thing that RCM leaders like myself have to worry about is all of the cost associated with getting it right. The rework, the multiple touches, and that's what we're trying to reduce or eliminate if we can.
Again, back to your theme of reducing some of that repetitive work, the unnecessary work, that ping-ponging between you have to do around a claim. It sounds like it's ripe for AI improvements.
Yeah,
right.
Absolutely.
So let's pretend for a moment, if I was an RCM leader at another organization that was a bit skeptical about AI, what would both of you say to me to maybe tip me over the edge a little bit to give it a try?
I would say try something, start somewhere. And one of the things that we typically do is look at something that is broken, or we're spending a lot of resources to get it right. But don't necessarily find something, implement it, and implement a bad process. You have to look at what you're doing and make sure that the ROI is there, because I think in the past, before we were trying to recover from our financial difficulties, we would have the luxury of implementing something and maybe layering it onto a process that wasn't optimized before, where now we're being very thoughtful. So I think that's the first thing I would do, is evaluate what you want to automate or use AI to do for you, and then try something. And if it doesn't work, then you try something different, or you tweak that to make it work for you. So the worst thing that we can do is not do anything.
Jason, what about you? What advice would you give me?
I'm in complete agreement with Sharlene. I think the first thing is try it out yourselves too at home and experiment with it. Get familiar with what AI is and what it does. And then be curious. And I agree with Sharlene. Pick something and start small and educate yourself on it. And that'll build confidence in the organization. Because I think one of the things that we've struggled with it as we have adopted more in our organization, and I know our customers struggle with the same thing, there can be a fear around the adopting of AI, right? And so I think just being curious and leaning in and experimentation, and if you fail, you're failing in kind of a controlled experimental way, that makes it much, much less scary.
So, Sharlene, you said something interesting off camera, and I want to come back to it. And that was, we've been talking a lot about AI and the importance of this technology, but you mentioned that we can't forget about the workforce and your existing staff. Tell me more about that.
Yes, so we talked about AI, we talked about the technology being really important to the solution, but I think the other secret ingredient is our workforce. So our employees, we want them to feel comfortable, we want them to embrace new technology, we don't want them to be afraid of what it's going to do, if it's going to eliminate jobs, and we want them to embrace it and then create a culture where we're constantly willing to innovate and think maybe how to do work a little bit differently. So I did just want to emphasize the importance of our workforce in this solution.
Jason, you're nodding in agreement.
Yeah, I totally agree. I mentioned in a previous question that AI can be scary, and that's exactly what I was referring to. It can be scary for an organization, and our people are absolutely integral to the success of adopting AI. And it's not eliminating jobs, it's eliminating some work. And the people that work on those jobs will shift to work on more complicated tasks that the AI is not tuned to do. And that's some of the cultural change that we as leaders have to drive in our organizations to make people less fearful about adopting AI and leaning in.
Where are you guys going next? What can we expect from Experian Health over the next little bit?
I am so excited about the future for revenue cycle management and the healthcare industry. I think there are tons of applications of AI. Specifically, what we're working on now, we've already released several AI products, and we're going back, and this technology is changing so fast. A product that we released 2 years ago, we're already working on an update to that product that's driving a 40% improvement in it, just because the AI technology is changing so fast. And then as I look ahead, some of these manual tasks that we've been talking about, the software will do some of those things. We can go get information, repair information, learn and update systems without humans having to touch that. But there are still things that go into work lists inside of HIS systems or other systems that cause people to have to do a lot of repetitive tasks. And I think the next chapter of automation and revenue cycle will be adopting agentic AI and starting to automate some of those tasks, like calling and sitting on the phone with a payer might be done with agentic AI, freeing up more time for staff to work on other things. We're looking at a lot of that as we look towards the future.
Sharlene, where can people go to learn more about your organization?
The best resource to learn more about Yale New Haven Health System is through our website. I can give you that URL. It is ynhhs.org.
Perfect. And Jason, where can people go to learn more about Experian Health?
The best place is also our website, experian.com/health.
Well, thank you to both of you for being on camera with me. It's been so great to have this conversation.
It was my pleasure to be here today. Thank you.
Thank you for having me.
What I took away from this conversation is the belief in AI is not the problem. Trust is. And as Jason and Sharlene explained, the fastest way forward is in small, high-impact wins that eliminate repetitive tasks and show measurable value quickly for healthcare organizations. When teams see real outcomes, adoption naturally follows. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Also, head over to healthcareitttoday.com for more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.